Hey, what's up, guys? I just want to tell you that this video you're watching, it's just a clip. You could watch the full episode on our YouTube channel. Also, you could check the whole episode on all platforms where podcast streaming is available. Right now there are a lot of new dentists listening, and probably they want to open their own dental clinic. What advice you could give to them in terms of like how they would spend if they have a fixed budget in this pandemic? What should they prioritize, what should they not prioritize, and how should they work on their dental clinic, opening a business at this kind of situation?
Well, I think it's an excellent situation whenever, you want to buy low and sell high. And when stocks are going really high, like right now, and Bitcoin's going high, everybody's piling into this stuff. And we all know how that story is going to end. You don't buy high and then lose all your money. And right now, because of this pandemic, real estate, so many restaurants have gone out of business. Everything's on sale. You're not going to go out of business as a dentist. I mean, Manny Pacquiao could not do what he's doing if he was missing his two front teeth. Dentistry has been here for 200 years. It's getting stronger every day. Invisalign. I would try to go to become an owner operator. You got to be in control of your own destiny. And right now, when COVID-19 and that restaurant just went out of business because of social distancing, and you can apply the lessons of retail, like getting in a visible location. If you're in a visible location and everybody can see you as they drive by in the car or walk by a busy neighborhood, well, then I'm not going to have to be marketing on Facebook and Instagram and direct mail. My advertising, like McDonald's, where does McDonald's always go? They always go where everybody already is. They already go to the most crowded places. When you're looking for a McDonald's, you don't have to go to Instagram and see where Ronald McDonald's last post was and see if he's near you. So I would try to make it your number one goal is to be in charge of your own destiny, to be an owner operator. Everything's on sale. You can get into retail space cheaper now than any time in the last 10 years and open up your dental office. And then just like Manny, you got to get out there and run for mayor. So instead of hiding behind Smiley Tooth Family Dentistry on the north side of Manila, no, use your own damn name. Get out there. And if you get out there and you keep running for mayor, and when you get done with the root canal, look what happens when a dentist gets done with the root canal. He goes back to his private office and shuts the door. He doesn't even know that he ran 15 minutes late. The next patient's upset. When Manny, I don't care if he wins or loses, after the fight, after the root canal, he shows right up to the announcer. He's ready for a post interview. He'll probably be interviewed around the clock for the next 2 days. When you get done with the root canal, why don't you walk up front and why don't you sit there and greet the next patient in the waiting room? Then your staff can say, oh, by the way, Howard, your next patient, Paulo, he's pretty upset. He had a 10 o'clock appointment, man, and it's almost 10:30. You're like, Paulo, man, I'm so sorry. You reach out, look him in the eye, shake their hand. You're running for mayor. I am so sorry. I was doing a root canal. I thought it'd take me an hour. That thing was so infected, and it was hard to get numb, and I didn't want to hurt him, and I kept giving him more anesthetic and letting it soak in. But just keep running for mayor of your own dental town, your own dental office. Be an owner operated. Be in charge of your own destiny. Don't live your whole life taking orders when you could spend your whole life giving orders. Be a leader to people who want to work for you and follow you. So give up the fear. Manny's lost some fights. He's taken some big fights and he's lost some. Try that root canal. Okay, some are going to fail. Try an implant. Some are going to fail. The highest failure rate you'll ever do in implantology is out of your first 10 implants placed. There's a lot of research on that. Your first 10 implants aren't very good, but I bet your last 1,000 implants will be really, really damn good. So just quit living in fear. Fear is not an option. And just like the vaccine, people are afraid of the vaccine. A quarter of Americans, including my own 82-year-old mother, are afraid of that vaccine. And I just don't see the data for that. And I don't see the data for you going out of business when you're a doctor of dental surgery in Manila. I mean, in a country with over 110 million people. I mean, what, you think dentistry is going away? You think you're going to go out of business, dude? Go for it. Go for it 100%, and quit just walking around the swimming pool, dipping your toe in the water, talking about how 5 years from now you're going to learn how to swim or play the piano. No, dude, dive in that swimming pool head first. You're not going to drown. It may scare you the first year, but 5 years out of school, you built up your own dental office. You're an owner operated. You're in charge of your destiny. And then from that moment on, if you can get off the first addictive drug that everybody's put onto, is other people's money. As soon as you can get off that drug, I'd rather you be stuck on alcohol and get off other people. I'd rather you be a debt-free drunk than being 65 years old and still owe several $100,000 to other people for the use of their money. So it's really easy. Just go for it. And by the way, I came out with a 30-day dental MBA back in the day, and it's all on YouTube. It's on iTunes. It's just called Dr. Farran's 30-day dental MBA. It's still downloaded 1,000 times a month on YouTube. But when I went to MBA school, I bought my first laptop. I took notes. It took me about 30 hours to read those notes back, so I made it 31-hour deals. Dr. Farran's 30-day dental MBA. It's for free on YouTube. It's for free on iTunes. But dude, you don't have to reinvent the wheel. It's not competitive. It's not like trying to be the heavyweight champion of the world. That is competitive. But trying to have a successful dental office that you own in Manila, that's extremely doable. There it is.
Oh, there you are. It's like you didn't age a bit, Dr. Farran.
Oh my God, you're too kind.
Wow, that's so nice. And yeah, I just want to
there's my baby.
oh,
And Zach just, oh my God, he was born in, he just made up his first child, little Evelyn. Little Evelyn's 4 months old. I can't believe
wow.
my oldest grandchild is 13, but time flies fast. You don't have 5 to 10 years to go working for someone else and living in fear. Just go for it.
Exactly, and clearly you can see that you are enjoying the moment as it happens, being with your family. But yeah, going to what you said, I totally agree. I think one of the things that patients would love for their dentist is that their dentist would be very accountable to whatever treatment happens. If something is up in terms of if you're late or they need to schedule something, they would appreciate it more if you are the one talking to them rather than the assistant. And also yeah, you would really do better if you just start doing it. Like, there is no perfect time, because the more you wait because you are a perfectionist, the more the practice evolves, and then there's going to be a new technology that you would have to figure out at that same time. So all you have to do is just do it, figure it out. And the cool thing about it is, if you don't know what's up, you could always check Dental Town and just search it up there.
And you know that what you said also was transparency. I mean, we talked about history just showed be transparent, not opaque, and be competitive. That's why I like DSOs, because DSOs, the things they do right, like they're open 7 to 7, 7 days a week. That makes me be more competitive with my group practice to expand my hours. And transparency with your patient. I mean, I give them all my cell phone number. I mean, I did a root canal on you, but I can't give you my cell phone number. I mean,
Exactly.
you give your cell phone number to all kinds of people, but you're not going to give it to someone that you just did a root canal and pulled their teeth. And when you call that patient that night and say, "Hey, I'm sitting down for dinner," and I'm sitting there thinking, "Gosh, I'm going to eat fine, but Paulo, are you able to eat? I mean, I pulled 2 of your teeth and did a root canal. Are you okay?" And he doesn't remember anything I did, but he remembers how I made him feel, and he thinks, that's pretty damn cool that my dentist called him up and said, "Hey, Paulo, this is Howard, your dentist. Are you okay, man? Do you need anything?" And that really, you make them feel the trust, the connection, the transparency. Just stay out there running for mayor, and you're going to get all your dreams or will come true in dentistry.
Exactly, because at the end of the day, being nice and kind is what people would remember. So it's how you treat them, and it's how your practice would evolve, and the word of mouth would happen from your patient as they tell their friends. Whoa, that's the end of the video. So cool you finished it. Don't forget to subscribe to all our social media channels. the YouTube channel, of course. Leave a comment, a thumbs up. Like, that helps us a lot. So, I mean, tell us, I want to hear what you think about what you just heard.